All right. Thank you for the privilege of the podium to present our institution's experience with laparoscopic revision, paraesophageal hernia repair. I don't have any disclosures. So there is documentation in the literature that laparoscopic paraesophageal hernia repair is safe and effective in relieving symptoms associated with hiatal hernia. However, long-term follow-up data also shows that about 30 to 50% of patients will have symptomatic recurrence, with about 6% actually requiring reoperation. Redo surgery is technically demanding and associated with a high rate of morbidity and mortality. And this stems from multiple reasons, including the presence of adhesions, the need to revise the fundoplication, and anatomic defects that actually precipitated the failure. However, there are multiple studies that have shown that revision foregut surgery is safe and effective and feasible, and associated with a success rate of 65 to 100%. However, majority of these studies contain very small surgical series, and the authors also use very variable perioperative and quality of life outcome measures. So at our institution, we're interested in evaluating the perioperative and quality of life outcomes of a large series of patients who have undergone laparoscopic revision PH repair within a 16-year period. So we performed a retrospective review of a prospectively maintained database of all patients who had laparoscopic revision PH repair. We then collected and analyzed demographic and perioperative outcomes information. We evaluated their quality of life with 2 validated survey instruments, and then performed descriptive statistics to evaluate our data. So after inclusion and exclusion criteria were met, a total of 190 patients were included in the final analysis. Majority of these patients only had a history of initial repair only, with a very small fraction with a history of a redo surgery in the past. In addition to a PH repair, majority of patients actually underwent a redo fundoplication, either complete or partial, with a small percentage actually requiring like an esophageal lengthening procedure. And about 70% of patients had a mesh placed during the time of surgery. The average length of stay was about 3 days. In terms of postoperative outcomes, our overall morbidity and mortality was 16.3 and 1.1% respectively. At a median follow-up of 17.6 months, our recurrence rate was 16.3, which is relatively high. However, only about 6.3% of patients actually required reoperation. In terms of quality of life outcomes, there wasn't any significant improvement in GERD quality of life outcomes during latest follow-up. However, patients did report significant improvements in their RSI quality of life outcomes, whether they had a history of an initial repair only or had a history of redo surgery in the past. So to the best of our knowledge, this is the largest series to examine perioperative and quality of life outcomes of patients who underwent laparoscopic PH repair at a single institution. And our results show that redo surgery is safe and effective and associated with like long-term improvement in quality of life outcomes, as well as low reoperation rate for recurrent symptoms. However, we need future studies to actually focus on long-term comparative analysis between redo and initial foregut surgery at our center. Thank you.